everyone, it's Eleanor here from Professional Beauty. Today we are going to be joined by Kate Kerr, who is a top facialist and owner of Kate Kerr London. So we're going to be chatting through rosacea and acne today. So if you've got any questions for Kate, please do send them in because we'll have some time at the end to go through those. So without any further ado, I'm going to bring in Kate now. Should be with us any second. Hi, Kate.
Hi,
Hello, how are you?
very well, thank you. Thank you for having me.
Oh, it's great to have you with us. Thank you so much for joining. So we're going to be talking through today rosacea and acne. So I think everyone here is really excited to hear what you're going to be telling us about that. So to kind of kick things off, can you tell us a little bit more about rosacea and what it actually is?
So, rosacea is a vascular skin condition. It's an inflammatory condition that generally affects the sort of the middle section of the face. We call it the butterfly shape. So, forehead, particularly in between the eyebrows, nose, through here, and on the chin. It's generally categorized into stages with redness, persistent redness, flushing, tingling, and burning, and especially on the cheek area. Broken capillaries, sort of a thickening of the skin. You can also get enlarged pores, papules, pustules, although they're a little bit different to acne spots in that they're more on the surface and protruding above the surface and more dome-like in shape, and they tend to last a little longer than an acne breakout. Or, on the other hand, you can actually get tiny little red dots that have little pustular head on them that you can almost just flick away and they'll be gone within a couple of hours. It can also affect the eyes. And it can affect the sort of a thickening of the skin tissue. So when people often think about the bulbous nose when they think of rosacea. Yeah.
Amazing, that's interesting. And what are some of the causes of rosacea?
They're not 100% certain. They think it's mainly genetic, and in fact they think it's sort of a 50-50 split between genetics and environmental factors. It's much more common in fair skin and skin that's naturally blushes even from a very young age. But I have it myself actually, obviously fair skin, and from the Celtic background is the most common. But generally it's genetic, and actually we treat a huge amount of rosacea clinic, and when you ask somebody if anyone in the family's had it, generally they'll tell you that either mum or dad suffers with it, or they may not have realized. And you say, does mum or dad's skin flush? Do you notice there's slight thickening of the tissue on the nose? Oh yes, they do.
So it's normally runs in the family then?
Yes. Yeah.
That's interesting. And what are some more of the symptoms of rosacea that as therapists and facialists we can look out for when we're treating our clients?
It's generally persistent redness is one of the key things, and it's usually across the cheek area. It is an oily skin condition, which is what people don't tend to realize, and they think of rosacea as just being sensitive skin, but actually it's generally an oily skin, and you'll often find that people that suffer from it will have suffered from acne teenage years. It generally starts to show in your 30s, maybe later if you're lucky, sometimes a bit earlier, but generally you will have had acne in the past. So it's activated by oil. And this oil causes a lot of inflammation, so you see a lot of vascularity in the skin, and it often starts with the flushing and the redness and the persistent redness, sort of tingling in the cheeks. I often find when mine is flaring that I feel like my cheeks are zizzing. It's quite an unusual feeling actually. And if I have particularly a drink of alcohol, because it's one of my triggers, I will get a real tingle in the cheeks, and it might get a flush down my neck as well. So redness and flushing is one of the key things. Also broken capillaries. And you might just see that in the corners of the nose. You might see the full telangiectasia across the cheeks. Those are the first couple of stages. Then you start to get as I said, the papules and the pustules, which, as I said before, also is slightly different to acne. Thickening of the skin, enlarged pores, and you'll find that they'll get much larger with age. And in fact, some people may not get the redness. And if you've got somebody coming into your clinic who's 40 plus is complaining of sensitivity across the cheek area, and a lot of burning and tingling, and you see that the pores have become enlarged, rosacea is a thing to look out for and to think about when you're diagnosing. Then obviously, as I said, the tissue thickening, and then you might also get the eye involvement as well. They talk about the stages, stage 1 to 5, with those particular things, but I think staging is not a very correct term, because you don't necessarily start at stage 1 and progress through to stage 5. You might have stage 1 and 2 and progress further and further, so that you have stage 1 and 2 but very severely, or you might just have stage 1 and 3 and it be super mild. So it's not sort of correct terminology, and I think it leads people astray, but it's generally a condition that does progress. You can go into remission, it can disappear at times, but it will come back. And I often find with people, unless you're treating it, it just tends to get worse and worse. So it's one of the don't want to ignore. You want to be treating that with somebody, and you want to prevent the progression, because it's much harder to claw it back once it's progressed to the latter stages.
And in terms of treating rosacea, what would you normally recommend for people with rosacea?
So it depends on the severity, but not only the severity, you need to look at the psychological impact. So somebody might have very mild rosacea, but they've had it for years and it's really affecting their confidence. So you need to take those two factors into account. If they're psychologically quite affected, and also they have got moderate to severe rosacea, it's best practice to recommend that they also see a medical professional alongside your treatment. And you can treat in clinic. School yourself, do a lot of research, find out about the medical treatment of rosacea, so that you can work alongside that in clinic, and you can help to complement that, because it's important. Often with seeing medical professionals for these sorts of things, they are just treating the disease and the symptoms of the disease, and they're not looking at the overall skin health. And it's so important that the skin, as our body's biggest organ, that it's functioning really well, that every cell type within the skin is functioning well, so that you have a skin that looks beautiful, and a skin that is less likely to have disease and disorders, but also a skin that will age more slowly. So I believe in the treatment, clinical treatment, medical treatment, but also with skincare as well. We are quite, I don't want to use the word aggressive, because it can be sort of negatively taken, but we treat rosacea very actively in clinic. I'm not a soothing, calming, pet the skin, be nice to it. Well, I want to really push the skin and make it wake up and work for itself. And with rosacea, the key things are making sure you've got a really strong barrier function. So strengthen that barrier. That will also prevent the transepidermal water loss, so the evaporation of moisture out of the skin, to help with hydration. It will also make the skin glow more, but we also want to inhibit oil production. So we want to make sure that there's less oil that's causing more inflammation, stimulate cell turnover, have a really healthy keratinocyte maturation cycle, so the KMC cycle, which is the division of cells and the movement of them to the surface of the skin and is sloughing off. We want that to be functioning really well, and you'll see also that that's very important in the treatment of acne. So we get somebody on a regime that is going to do all these things: strengthen barrier, ensure a strong, healthy cell turnover and cell renewal, control that oil, and we often get them on a retinol to help to regulate all of that, to help thicken and strengthen the skin. And we might I always get people on a skincare regime that wakes the skin up, strengthens the skin, helps it to be resilient. Then I look at things in 12 weeks time, which is 2 skin cycles. Do we need to actually go any further with treatment? Are we not getting anywhere and we need to do a referral to a dermatologist or a GP? Or do we feel we need to step up? We might have corrected the papules and the pustules, but we've still got some underlying redness and some broken capillaries. So then you could look at your lasers and your lights, IPL and those sorts of things as well. That's how we would, yeah.
Amazing. And in terms of treatments we shouldn't use, are there any sort of no-nos for treating rosacea?
I would be very careful with exfoliation, microdermabrasion in particular, but a lot of advanced treatments are actually very beneficial to rosacea, as long as the skin is strong, resilient and prepped. That is really, really important. And I'm not talking a 2-week prepping. I'm talking a good 2 skin cycles, so 12 weeks, even longer, because if you've got had chronic inflammation with like rosacea, you've had it for years, it could take much longer to knock that inflammation on the head and calm the skin down. And you need to make sure the skin is calm, functioning beautifully, and then we could boost it further with peels or microneedling or anything like that. But peels are actually very beneficial for treating rosacea and helping with that really healthy cell turnover and helping to refine the skin's texture. If you've got that thickening of the skin, also helps with pore size. So if the pores are getting larger, which they do with rosacea, so the sebaceous glands get larger and larger, you want to do treatments that are going to put pressure on the outside of that pore to help to minimize the pore size. So anything that's going to induce collagen production would be really beneficial.
Brilliant. Yeah. And in between clients that are coming to see you, in between treatments, what sort of home care are you recommending for clients with rosacea?
So they're on regime, and certain ingredients that I'm looking out for: salicylic acid to help control oil production, because as I said, it's an oily skin condition, so it's one of the most important things. You want to use salicylic acid. You want to do exfoliation. A lot of people are quite frightened of exfoliation, particularly with an inflammatory skin condition, but actually when you speed up cell turnover, you also speed up cell function. And when people are not exfoliating, they get an accumulation of dead skin cells on the surface. It's like a crumbly old brick wall. That is a skin that looks dull because it can't reflect light very well, but anything can get in. So it means the skin's more on edge. So, and the inflammatory systems within the skin are on edge and on high alert. So the skin becomes inflamed more easily. So we want to really strengthen that barrier. So exfoliation is key. Use lots of antioxidants. The number one thing with treating rosacea is sun protection, because sun is a big trigger. And also they think that even those who genetically have rosacea, if they've never had sun exposure in their life, they may never have activated their rosacea. So it's important to really protect the skin against the sun, and do that when you get up first thing in the morning, and then take it off at night. If you're inside and there's daylight inside, you've got UVA bouncing around in there causing damage. And obviously at the moment with COVID-19, we're on our screens where we've got blue light coming off the screens on our phones and things like that will also cause the damage. So sunscreen is really important. Exercise is fine, but make sure that if you've got quite moderate to severe rosacea and you really find you flush during exercise, swimming is excellent because the cool water helps to cool the skin. Also, or exercise in front of a fan. Try not to do things that get you too hot and flushing, and I know that's a shame, but you might be able to, if you go onto a skincare regime that actually stabilizes things and calms down, then you can push your exercise further. But you want to try and minimize your triggers, and everyone's triggers are different. So exercise, facials once a month are very good for stimulating the skin, and then look at your advanced treatments as well. What else for home care? Look at your diet. Alcohol is a trigger, hot drinks, hot spicy food, minimize those. The key thing they say is to look out for your triggers and try and minimize exposure to your own triggers. Yeah.
Amazing. And are there any other kind of like maybe environmental triggers that can affect rosacea? Like, does it affect differently in the winter or summer months?
Yeah, because your oil gland is directly stimulated by heat. So hence why the more exercise you do, the oilier you get, the more breakout you get. In summer, it's the same thing. Initially, in summer, your skin can actually improve because it kills the P. acnes on the skin, but actually it will thicken the skin and cause more inflammation. So sun is a big thing to try and stay clear of. What else? Smoking.
Yeah.
And trying to have a low GI diet, not having lots of foods that are cause inflammation in the body. And actually they think there's also a relationship between BMI and a high BMI and rosacea. So looking at, your health is really, really important actually with rosacea. Yeah.
So it's really kind of tricky at 360.
Your skin, you get more water loss out of the skin in winter. And so the skin becomes naturally more dehydrated. or we might find that we're going from the hot to the cold a lot, and that can also exacerbate it. So it's trying to keep the skin temperate is really, really important too. But you'll find if you're on good skincare that is stabilizing things and helping to calm those inflammatory processes, as well as inhibit your oil production, you'll find that you'll tolerate these things much better. And as I said, if you've got moderate to severe, then I would definitely go and see a doctor or dermatologist and get onto some either topical medication or even systemic medication.
Okay, brilliant. And if you have a client and you're kind of deciding whether to recommend them to go and see a GP, how can you differentiate it between being mild and moderate?
So I look at how much it's bothering the person for starters. So you're not just looking at the clinical show in front of you. You're taking the emotions into account as well. So I look at that, and I also look at if you've just got somebody who's got redness and flushing and free broken capillaries, we can help that. Same with a few spots. If you find that they've got the thickening of the skin tissue, they've got really enlarged, or they're getting a lot of the breakout repetitively, then I would often recommend that. Now, I give them the opportunity to say, we can refer you now. We can try and treat you in clinic and refer you if we don't get the results we'd like. Or we can do both. I can refer you and I can treat you in clinic, because I understand how those medications work, and I know how to safely treat your skin in clinic alongside that medication. So yeah, look at the presentation, the clinical presentation on the skin, and if it's affecting the skin thickness and the texture, that is long term. And that is long-term damage that we want to prevent. So I'd try and quickly get on top of it and send them off to the GP or a dermatologist then.
Amazing. Thanks to everyone who sent in your questions so far. We're going to have some time at the end, but I want to make sure we can also cover acne as well, because that's the other one that we wanted to discuss today. So Kate, can you tell us a little bit about the different types of acne that you can often see in clients?
So it's all about the different types of lesions that somebody has on their skin. So you've got comedones, open and closed comedones, so blackheads and whiteheads. Blackheads are the obviously the black, the darkening of the debris within the pore. Whiteheads are not a pussy head like people think. It's the colourless. There's no inflammation, so just a skin-coloured mound in the skin. Then you've got papules and pustules, which is spots basically. The pustule's got a pussy head on it. You've also got nodules and cysts, so when you get a lot of swelling underneath and that hard nodule underneath. And some people might have, usually everyone has comedones, so open and closed comedones, so they're your blockages in the skin. And then from there, inflammation sets in, and that's when you're more likely to get your papules and your pustules, and then cysts and nodules, which are a little bit more rare.
Great. And how do you go about treating different types of acne?
So with acne, it's an overproduction of oil. Now, whether that's just genetic or whether that's hormonal, it doesn't necessarily matter. Still treat the skin. You would look at that if you're not getting results in clinic, or if it's moderate severe. But even somebody who has very hormonal acne, they might have a blood test and their hormones are actually showing to be perfectly in perfect balance. It's just that their sebaceous gland is actually very sensitive to the oil that they are producing. So we with the blackheads, it's important to prevent the blockages basically. So we want to calm that oil, because oil is the number one thing. Also cell turnover, so we get an accumulation of dead skin cells on the surface of the skin, and that cell division, or that cell renewal that I was talking about earlier, slows down and becomes sluggish. So we really want to normalize that. So those are the key things to prevent, and then you'll want to inhibit your inflammation and kill that acne bacteria. That is how you sort of go about it. And we would do that with topicals, so a skincare regime, because I can't change their genetics, I can't change their hormones. So it's about control, and we need repetitive exposure to certain active ingredients to get control. So your morning and evening regime is extremely important. Then also regular extraction facials. So facials where we're extracting, because if you're getting rid of all the blockages in the skin, then you're not going to have anywhere for that acne bacteria to invade. So you're going to get less of the active breakout. So extraction is extremely important. And then obviously for moderate to severe, or again, somebody who it's really affecting psychologically, we would refer to a dermatologist. And we need to always, consulting with somebody in the first instance, offer that. You need to say to them, obviously if it's mild, you wouldn't bother. But if it's moderate to severe, you need to give them the opportunity to be able to go and see a medical professional. Because if you're getting scarring, if you've got scarring currently, or you think that you've got cysts or nodules, they almost always scar the skin. So we need to get on top of that, because that's long-term damage. So that then I would definitely refer to a dermatologist or a doctor. And again, we can work alongside that. So it's quite build a relationship with a dermatologist that you know, learn how they prescribe, learn how they treat the skin, so you can educate, because a lot of people are quite nervous about that. So we educate them on how that dermatologist might look at treating that skin, and say that that would be really beneficial alongside what we do, and making sure that the whole skin is healthy. So we are targeting skin health and skin function, cellular function, everything, to make the skin look glowy and beautiful. The dermatologist doesn't necessarily care about this beautiful glowing skin. They just want to suppress that disease, skin disease. So the two together can work very well.
Yeah, taking the two-pronged approach sounds like a really good way of approaching it.
Absolutely.
And in terms of home care as well, what ingredients do you recommend for acne, clients who have acne?
So we want to press the oil, and we want to regulate that KMC cycle. Those are the key things, really, the first two. And so salicylic acid is very, very important. Salicylic acid is an exfoliant that dissolves away the desmosomes, or the bonds that are holding those dead skin cells together, and it encourages exfoliation. It's lipid soluble acid, so it can exfoliate within the pore, not just on the surface like other acids. And it has an anti-inflammatory and an antibacterial effect. So salicylic acid is extremely, extremely effective in the treatment of acne. And we use salicylic acid in cleansers and exfoliants, so wash-off formulations, but we also use like toner type things that leave a film on the skin for oil control in the day. We also use benzoyl peroxide. Benzoyl peroxide is excellent at treating acne and helping to dry out the spots, and also help to suppress oil production. And that's really, really important with treating acne. Now, it's important that you're educated on how to use it, because it will dry your skin out, and it will cause inflammation when you first start. And it's just your skin's panic to that speed up of cell turnover. It's a good thing. In fact, the inflammation, it will help to suppress that sort of acute inflammation that we induce, helps to suppress the chronic inflammation of the acne. So it's a good thing, but it's scary for people, and that's why it's very, very important to educate. So benzoyl peroxide is another one. Retinol. So retinol helps to regulate cell turnover. It also helps to renew the skin where you have had breakout, to lighten the post-inflammatory hyperpigmentation. It helps also with controlling oil production to some extent. It's not a superstar there like benzoyl peroxide, but it is very good. But you just need to look at Roaccutane, for example, which is systemic vitamin A. That is one of the strongest anti-acne treatments. So vitamin A is excellent at treating breakout-prone skin. Azelaic acid is also good, and niacinamide. Those are some of the key ingredients that I would look for in treating someone's acne. And then one of the most important things, extraction, but don't do it at home, because even myself as a professional, I can't do it very well to myself. It's the wrong angles. So you need to go to a professional who can do that for you in clinic. Yeah.
Brilliant. And are there any other environmental or lifestyle factors that can affect acne as well?
Yeah, the thing is, in our clinic, we're careful to not say things unless it's backed by studies and science. So I don't go a huge amount into diet. We know that high GI diet can cause inflammation. We know that stress and things can activate your hormones. We know that a very unhealthy diet can also affect your hormones. So then that definitely can help or impact your acne. So I'm careful to say that, but we generally say our low GI diet Drink lots of water because it's just important for cell health for the whole body. Those are key. Exercise is very good, but make sure you've got nothing on your face. If you're outside, you obviously need a sunscreen on, but try and exercise inside with nothing on the skin. So cleanse the skin first, and then you allow that sweat to flush because you're getting hot, so you're activating your oil gland. You're going to get excess oil. So we want to allow that to flow freely and not get blocked in the skin. We then want to wait for the skin to cool down after exercise before you have your shower. When you shower, then use your salicylic acid cleanser to really cleanse within the pore. So exercises can be really beneficial, but it can also have a terrible impact if you're not doing the correct skincare. Your HIIT workouts where you're getting a lot of cortisol, or you're doing heavy weightlifting, and not so good for acne, because you've got high testosterone. It can activate high testosterone levels, and the cortisol is not good for your hormones. Cortisol hormone is not good for maintaining the balance of your hormones, so that can also impact it. Heat, as I said, is key. So no saunas, steam rooms. Don't even put your face under the shower head. You need to keep your skin calm. Not using hot water, use warm water, because these things all activate your oil gland. So keeping the skin calm. What else did I put? Yeah, sun exposure. People often think sun is good for acne. You will find at the beginning of your holiday, your skin might clear up a little bit. That is because the sun will kill the acne bacteria. Also, the tan that you get in your skin can hide that redness. Your skin may look like it improves, but actually that the constant heat will activate your oil gland, and you'll find you'll start getting breakout. People often find they start getting breakout when they get home. And also that repetitive application of sunscreen over and over in the day can also congest. So I always recommend using a clay-based mask every day when you get in from the beach. Can't put it on for half an hour, take it off, do your makeup, go out for the evening, but just, yeah, try and control that oil.
Brilliant.
So, sun is not a good one. It also thickens the skin, and you get enlarged pores, and it's not a good one. Please don't be using the sun to control your acne.
Brilliant. There's some really good advice there. We've had a few questions through, so I'm just going to go through as many as we can in the time that we have. We've had a question about rosacea. Can you get it with pregnancy?
Yeah, absolutely. It all sorts of things can. So I'd say it's probably genetic, but because you've got more blood flowing around your body when you're pregnant, it could be the trigger that activated it. It could be the change in hormones whilst pregnant that activated it. So yeah, definitely. Also remember, with the hormones, you find, especially in the early stages of pregnancy, you can get a lot more oily, and that oil can exacerbate your rosacea. A myth that oily skin is good. Oil is not good for our skin. Oil is an inflammatory substance that is left over from the evolutionary process where it lubricated our hair. It is not involved in a healthy skin. It causes acne, it causes rosacea, seborrheic dermatitis, perioral dermatitis, and it can even cause pigmentation, and people don't realize that. So oil is not a good thing. And all sorts of things unfortunately can activate it. So when you're treating your skin, if you're looking at your skin and you're showing skin conditions, you want to try and get your oil under control.
Amazing. And similar question here, actually. What about the menopause? Can rosacea cause, I guess, crop up at this time as well with the hormonal fluctuations?
Same thing, yeah. And also, probably people going through menopause at now are probably likely to have grown up a lot in the sun without sun protection, because even back when I was young from New Zealand, we were out tanning, and so we have that accumulative sun damage, and that is what will activate your rosacea and cause it to come out later. So yeah, absolutely. And you do find those are often the triggers. So the change in hormones in your early 30s, your pregnancy, and again menopause can be those sort of pivotal moments where it can activate.
Brilliant. And what sort of peels would you recommend for rosacea?
I would look at peels that are a little bit more gentle. So we know that glycolic is very irritating, so I try and stay away from glycolic peels. But salicylic acid is very effective because it's got the anti-inflammatory effect and antibacterial effect as well as being able to control the oil. But also lactic acid is also very good because it's a hydrator. It's one of the more gentle peels, but it will still do a very good job. But you'll get less inflammation from it. And not that then inflammation induced from a peel is a bad thing. It's very different from chronic inflammation already in the skin, completely different processes. But a lot I find with people with an inflamed skin, they're nervous about inflammation. So when I'm telling them that I'm going to induce more, can make them a bit nervous. So I'd probably go more gentle with it, and build up. So yeah, lactic acid is a good one for that. And as I said, it's more hydrating as well.
Brilliant. Just going through, I think we've got time probably for a couple more questions. Does salicylic acid thin the skin?
No, not at all. It thins, any acid is going to thin the stratum corneum. If you think you've got 5 layers of dead skin cells, so your stratum corneum is this is your dermis, is where your collagen, your elastin, your oil glands, everything, the main sort of structure of the skin is down here. This is the skin that you see, and the upper layer is your stratum corneum. Now, when you look at a beautiful skin, like a very glowing skin that's reflecting light, you know that they've got a really fine stratum corneum. And that's our goal when we're treating skin, because that also ensures a really strong barrier. So you get rid of all those dead skin cells and you expose the fat, juicy cells that are very tightly glued together. That is important. And salicylic acid will refine that, but that's all. And the cells are held together by desmosomes or glue, and those desmosomes release naturally, and then those cells slough off. But because we use products, sunscreen, makeups, any skincare, we don't allow the natural desquamation of the skin. So we then need to mimic that process ourselves by exfoliation, and salicylic acid is a really good one for that. So you'll see the surface of the skin become finer, but it's not going to have an impact underneath. It's the same with retinol. People think retinol thins the skin. Not at all. It actually will thicken the dermis and strengthen the dermis. It might refine the stratum corneum a little bit, but can actually also thicken the epidermis. So it's very, very beneficial for thickening the skin.
Amazing. Oh, it's been brilliant talking to you, Kate. We've had loads of brilliant advice from you, and I think everyone listening is loving it as well. So thank you so much for joining us. And for everyone watching, please do join us again for more lives this week. But for now, thanks very much, Kate.
Thank you. Take care.
It's been a pleasure. Thank you.